That's it's a rare event, I think, and I'll ask Per maybe to answer because he's got considerable experience as well. I think that it's a rare event. Most patients who have got what we call classical symptoms from a neuroendocrine tumor, most patients will have a what we call a considerable volume of disease. So it's not just the size of a pea, although that can happen. But most of them, let's say, if you took carcinoid syndrome, for example, flushing and diarrhea and some other symptoms like that, the vast majority will have even, some lesions in the liver, or if there was nothing in the liver, then they'd have a fairly big lymph node in the tummy somewhere. So you'd have enough tumor tissue secreting hormones and peptides that result in the symptoms. That is sort of a general rule of thumb. There are some tumors that can be very small and secrete a significant amount of hormone or peptide. And gastronoma is one. They're in the pancreas or in the duodenal wall, especially in the duodenal wall. And they can be very, very small, impossible to detect almost. And they can cause diarrhea and secretion of a hormone that causes increase in uric acid production. That can cause peptic ulcer disease, ulcers of the stomach and the duodenum, and diarrhea. And they can be very, very small and very hard to detect. So there are a few exceptions to that general rule of thumb that I gave you. And there are a few others as well. Per, would you like to comment?
I was going to tell about the gastronoma as well, as I talked about this morning also a little bit. But it might be the situation that it's not carcinoid syndrome you're talking about, but a hormonal syndrome from, for instance, gastronoma. The carcinoid syndrome we stick, that's the ones that are the serotonin producing tumors with diarrhea and flushing. And then there are other tumors that produce other hormones that gives other syndromes, but it's not the carcinoid syndromes. Might be misunderstanding there.